Afternoon, everybody. Welcome to this afternoon's webinar. A little bit different today on Airmeet, which I'll tell you all about in a minute. Hi, I'm Paul, if I haven't met you before.
The Foundations webinar.
So much of the rest is the same, but Airmeet's a little bit different. And I will get onto that very shortly. But if you haven't heard of Foundations before, we support local authorities and home improvement agencies across England. We're funded by the Ministry of Housing, Communities and Local Government, and we're here to help. And you can find all about us at...
Find out more at foundations.uk.com.
So that's what we've got coming up today. We'll have Sally Stoneburn from Branch Properties in a little while. I'll be telling you about some of the stuff that Foundations Independent Living Trust's doing. We'll have the DFG surgery and some of the bits of news. But first, I will tell you about Airmeets.
The DFG surgery. Your questions answered.
And that'll be later. So Airmeets are a bit like Zoom or Teams, but with extra features for you to socialise with each other rather than just watching and listening to a webinar as we usually do. Now, obviously, if you just want to watch and listen, you can still do that, but you can also meet other people either individually or as a group. And this month's webinar is going to be a little bit shorter so that you've got time at the end to try out some of these features. So just to go through with you how it works, that's kind of what the screen looks like. So firstly, over on the right-hand side is a group of 6 icons. So the bottom one is questions. So if you've got any questions for the DFG surgery towards the end of the webinar, then pop your question in there and I will try to answer them a little bit later. Next one up is chat. So your kind of usual chat box as you kind of have on Zoom or on Teams. So if you've got any thoughts, messages, comments, then please put them in the chat as we go. Any thoughts that you have about Airmeet would be really good. Next one is attendees. So if you click on attendees on the right-hand side, you can see all the icons or little icons for everybody who's here today. So you can see details of everybody who's here. And if you hover over each one, there's 3 little dots. So if you see somebody that you know, you can click on those 3 little dots and send them a direct message and either arrange to meet at one of the tables or just continue to chat using that chat feature. Next one I was going to point out is raise hand. So, you know, like when we used to do the road shows and we'd wander around with a microphone and you could ask a question. If you want to come up onto this kind of main stage and speak and possibly be on camera as well, then you raise your hand. I can go to you and I can give you the virtual microphone. Is anyone brave enough to raise their hand? I know somebody's thinking about it. There we go. So that's a couple of people. Let's go to Brian. Hi, Brian.
Hi, Paul. How are you?
Good, thanks. You're live on stage.
Thank you very much. What would you like me to sing?
I don't know. And
I was locked down. You okay?
Yes. It's I think probably last time I saw you was up at the last roadshow we did, wasn't it, in Leeds?
Yeah. That's right. Yeah, we were just talking about that. It was a pretty good roadshow, wasn't it, Leeds?
Yeah. Shame we can't do those anymore, but I'm sure we'll return at some point.
Yeah, I'm sure. No, good stuff.
We got Amanda there as well. Hi, Amanda.
Hi. Just want to say this is a really good platform. Really good. I like the little rooms that you can go in and chat to people.
Yeah, it's nice, and you go and sit on a table and have a chat.
Can anybody set them up?
Yep.
Oh, great.
Yes. Yeah. Well, I can set up the tables in advance, but yes, yeah, you can have whatever tables you want. So yeah, I hope you enjoy the rest of the day.
Thank you. Bye.
Thank you. So yeah, if you want to ask a question in person at the DFG surgery later in the webinar, you can through that. The next feature is, I see some of you found it already. There's a little emoji button at the bottom of the screen. So if you want to give your thoughts, thank you for the blue heart, whoever that was. You can give your thoughts through the pair of emoji as we go through the webinar. And the one next to it is for polls. So it only does yes and no polls. So we'll try and do a yes and no poll in a minute. And then if you're having issues with the quality of the picture, you can switch from HD to lower quality. So it should improve or it won't drop out so much if you're having connection issues.
Hold time. Let's see what you think.
So those are the main features of Airmeets, or certainly during the main sessions. So are you working from home today? Hopefully something's just popped up to say yes or no. So yeah, 75% are working from home still. So we got another little poll a little bit later on. So those are all the features during the webinar bit itself. But for those of you who've joined late, or those of you who arrived early, you'd have probably seen this screen a little earlier. So there's a few features on this screen I just wanted to point out to you. There's at the top is speed networking. So if you click on Start Speed Networking, and if assuming somebody else has also clicked on Start Speed Networking, it will link you to another random person who's at the event today, and you get a chance to have a 2-minute chat. So you can chat about whatever you want for 2 minutes, and then there's no awkwardness in ending the conversation. You just kind of fade into black after 2 minutes, and it ends, and you move on to talking to your next person. So you can get through quite a lot of people, 2 minutes at a time. And then the other bit, which I know some of you have already been to, are the tables. So we've got a range of tables, and you just click on the join button, and you can go and sit at that table and speak to whoever else is there. So some of those are manned by, or attended by people from manufacturers and suppliers. So you can go and have a chat to them about their products. Others, for instance, there's an OT table or a caseworker table or a technical officer table or a manager table where you can go and have a chat with the managers, OTs, technical officers, or caseworkers. And when there are people at the table, their little icon appears there. If you've added your photo, your photo will appear there. And so you can see us at the table and go and join in the conversation there. So it's hopefully added in some extra socializing features that you'll like. But let us know in the chat what you think of them. So that's all about Airmeets. And just to let you know that next Wednesday, we're hosting on behalf of Housing 21 and the Housing Dementia Working Group a free online conference where there's a platform to share value and showcase the lived experience of dementia. So there's a whole range of speakers, including a keynote speech from Lord Best on aids and adaptations, designing outside spaces, why home matters, and the latest developments in the private rented sector. So there's the link there. If Dan's around, if I could ask you, Dan, just pop the link in the chat box if you want to join, and it'd be good to see you there next Wednesday. And I mentioned this last month, but it's very close now. Our new website is very nearly ready, and be at www.foundations.uk.com. We've completely restructured it and made it fully accessible for anybody with various conditions and disabilities. So that should be live by the end of the month, and would love your thoughts on it. Also mentioned this last month, shower adaptations. Are they all the same? No, they're not. But different local authorities have different approaches to tiling and decoration, shapes and types of shower area, whether they replace the sanitary ware or not, what they do for floor coverings. So what we've got is just a standard layout of a bathroom and a couple of photos of it, and a kind of persona of the people that live there. So if you would like to do a drawing of how you would adapt this bathroom, and if you can, tell us how much that would cost. We're going to collate them all together for a future webinar to kind of compare and contrast the different approaches to shower adaptations across the country. So if you're interested, drop us a line at info@foundations.uk.com, and we'll send you the pack with all the information in for you to design an shower adaptation for this particular bathroom.
And now it's time for the guest.
Okay, we've just got one guest this month, and it's Sally from Branch Properties, who's hopefully about to join us. Hi, Sally, I think you're on mute.
Bear with me.
There we go.
Am I unmuted now?
Yeah, I can hear you now, Sally.
Hi, good afternoon.
Great, I've put your slides up, so let me know when you want to move on, and I'll guide you through them.
Lovely. Thank you very much. Good afternoon, everybody. As Paul said, I'm Sally Stoneburn, and I'm the founder and director of Branch Properties. So I'm really delighted to be asked to be here today and to talk about how we help to find, source and provide accessible properties, and how we meet the accommodation needs of disabled people. Also a little bit about how our journey began, and also how we reach all of those who need our help. So it's really nice to see that so many OTs are participating today, as obviously we work with many of you and case managers assisting clients who need our help finding new properties. Next slide, please. So I'm really delighted that I'm really proud to be known as the accessibility specialists. So starting out as a traditional letting agent, we specialised in accessible housing. We're the only agent in the UK at the moment offering our bespoke services. So I started the business back in 2015 and specialising in inaccessible housing, as there was an obvious lack of assistance and support in this area. I saw firsthand the need for these services as my father is disabled. A lot of people think, finding accessible housing is straightforward and all bungalows look like this one in the photo, but sadly that's not the case. And anybody looking for accessible housing will be able to agree with me on that point, I'm sure. Next slide, please. So there are 13.9 million people in the UK that are disabled. So that's a staggering 1 in 5 of the population. So that means that 93% of homes are not even visitable by a disabled person, let alone livable in. There's a massive gap between what is needed and what is available. And unfortunately, this is the accessible housing crisis, and this is our reality. So this is my father, who I mentioned to you a little while ago. As a young man in his 30s, he was diagnosed with MS. Eventually, he could no longer get around his home safely and went from independent to dependent. He was only in his 50s. So seeing him struggle physically and emotionally whilst trying to search for properties drove me to start the business. Next slide, please. So we have a growing accessibility crisis. 80% of our clients are wheelchair users. This shows the need for our services is huge. This need is only going to grow. the number of people aged 60 plus is set to increase by more than 40% in the next 20 years. And yes, that means most of us will need an accessible property at some point. Age UK say that the cost of bed blocking is equivalent to well over £500,000 a day. Our services allow the disabled people and ageing population to prolong independence in their own homes and to free up hospital beds, which is a huge saving. Next slide, please. So what's our specialism? We're passionate about accessibility for all and equal housing opportunities. Housing is a right, not a privilege. Following setting up as a letting agent, we then began promoting our specialism as property finders. And what sets us apart from other agents offering properties is that we provide a platform for people with disabilities. This is because we understand that to make a home for people with disabilities, there will need to be changes and adaptations, and we are sensitive to these needs. Next slide, please. So anyone who has been out there and tried to find accessible properties will understand this. Searching for suitable properties is very difficult. If I could tell you how many times I've turned up an accessible property after lengthy conversations with agents, only to say it's accessible when you get in there, or it's only got one step. If I had £1 for every time that happened, I'd be a very rich woman. Many of the properties that we turn up to have split levels inside. And there's also an assumption that in all new builds that they will be accessible. No, this is not the case. And a lot of them only have one lift, which won't work for a disabled person as the risk is too high of them being either stuck in or stuck out of the property. It's not easy and very time consuming, but we do this so we can safely say our clients get through the front door of the property and it will work for them. Next slide, please. So what's our solution? So as the accessibility specialist, we've helped over 100 individuals into safe and independent living. And we're the only accessible letting agent in the UK, as I mentioned, offering all these bespoke services, finding and adapting, letting and managing. We started out in London and increased our reach to Greater London and an hour within the commuter belt. We do have requests from all over the country with people needing to be independent in their own home. Next slide, please. So we help three main groups. First, individuals like Jess. This young lady, you can see her very happy collecting her keys. So she's an independent young lady, and it took us almost a year of searching to find her property. Second, you can see we've got a young man called Josh who, after years of fighting, won a medical negligence claim. We found and fully adapted his home for him. And then third, we work with quite a lot of graduates like Vabib going into the workplace. He's now a very successful associate working for a major law firm. So none of these clients would be leading safe and independent lives if it wasn't for living in their accessible homes. Next slide, please. We mentioned about the fact that we also adapt properties where needed. This is the case a lot of the time because more often than not, properties are not accessible, as I've mentioned. One of our clients that we needed to do a huge job for, we needed to modify quite a lot of the house, as is often the case. And the biggest job was adapting the bathroom into a wet room. He said, I want a beautiful bathroom to be proud to show my friends, and that's what he's got. This was a huge project with the outside also need doing, and we had a very happy young man at the end of the project. Next slide, please. So how can we reach all of those people that need our help? we work very, very closely with a lot of disability charities and organisations. We also work with many housing charities, and as you can see, we we work with all of those who support disabled people, such as case managers, occupational therapists and carers. We ensure that we work hand in hand with accessible housing specialists, and we're constantly looking to get our name out there, such as you can see me here doing a talk raising awareness of the accessible housing crisis through the Young Foundation. At least you can see my face on this one, I suppose. Next slide, please. So how do we promote accessible living? In many different ways. We were very lucky to be asked to go to the House of the Lords earlier this year to discuss the issues and how we can help. Lord Shinquin, who's a disability advocate, he said, for many disabled people, housing determines whether they can get a job. It is a prerequisite, and they are 4 times less likely to be working than those in accessible accommodation. That's quite a statement. So we were very proud that following that, we were asked to provide evidence for the CSG Disability Commission. And we work with landlords and developers to provide much needed accessible housing. We were also asked to join with accessible housing experts to produce the good practice guidance through the NLA, which was rolled out to all the landlords. And this is where we got to know the excellent work of foundations and worked with other accessible housing organisations such as Habingtag. Next slide, please. So one of the most exciting and brilliant ways that we're getting our name out there is what we want to talk to you about in full today, is that we're very proud and delighted to co-write and produce the ultimate guide to finding accessible homes. So we wrote this with the Disability Horizons, and this has gone out to all of their members and obviously all of our members and contacts. So it's gone out to thousands of people, letting them know how we can help and what we can do and what is needed to do when you're looking for an accessible property. So this guide can give a comprehensive overview of everything you need to know to help you find a new home from start to finish. What we do is we aim to help you to understand the accessible housing market and accessible features, as well as give you practical and straightforward advice on how to find a property that suits your needs. So if you would like to see a copy of this, you can either go on our website and download it for free on there. We also will put our details at the end of this talk, so you can get them from there and ask for a free copy, which you can download. Otherwise, I believe Paul is going to kindly put the link into the chat at some point.
Yes, I'll find the link, or if you go there, Sally, if you just popped in the chat box, I'm sure lots of people would want to download it.
Okie dokes, I will indeed. Okay, so just sort of to finish off slightly, what's our vision for the future? So we've already worked all over London, Greater London, and we've even had clients relocating to London from the Netherlands and America, South Africa. So we want to be able to branch out, excuse the pun, all over the UK and have our branches everywhere, so we can have accessible homes for everyone all over the country. So we're always here to help. Please let us know if you need something or you know somebody who needs our help. We'll be really pleased to have a chat. So yeah, that just the final slide then, please, Paul.
There you go.
Yeah. So all that's left to say is thank you very much for listening. Thank you, Paul, for inviting us today. And please do like us on Facebook or Twitter. And again, you know, if you know anyone that we can help, please let us know. And yeah, thank you for your time.
Great, thank you, Sal. There's a couple of questions. I'll comment first that Claire says the guide's excellent and they're using it to support families seeking to move.
Fantastic.
Question from Joanne: is it just private rented or social? Can you help with social housing as well? And what are the costs for the service?
So we generally work with private clients. That's generally speaking, but we also do work with a lot of other clients that need to come into private housing. So, you know, what we're seeing now is that we are getting people in housing associations, and I'm sure you know this is, I know you know this as well, and council housing that isn't suitable. And if they've not been able to do the adaptations because the property isn't suitable for it, that they're kind of stuck in that, you know, there's not a lot of stock being made anymore. So we are helping both sets, and you know, we can, if people want to know our prices and services, please get in touch directly, and I'll be happy to go through those with you because they vary depending.
And is it just kind of homes in kind of London and the South East that you kind of find, but work with people who are moving there, or is it possible if somebody else needs a home somewhere else in the country?
Yeah, we've worked with clients all over the UK. Obviously, the proximity for us being London and Greater London is easier, but we are finding ways of working to be able to help people further. I mean, we've worked with clients coming over from Scotland as well. So and we've relocated clients into Manchester and Yorkshire. So, you know, we can offer our services. It's all very dependent on the particular circumstance, okay. Generally speaking, but we try wherever we can.
Right. And there's a question from Emma about, she says that their housing staff say they find it difficult to re-let adapted properties, which may be family houses, which is quite frustrating for her when it's already been adapted and she knows there's a need for these sort of properties. Did you have kind of any tips on how to kind of match people and properties more successfully?
Yeah, well, I mean, one of the things that we also do is work with helping to let properties and even to sell. I mean, we're not an estate agent, so we can't. But one of the most frustrating things is when landlords or vendors have got beautifully adapted properties with, you know, modifications and things, and they're finding hard to let them on or sell them on. So we do try to match those people up as well. You know, I mean, we then often put things on our website, Property of the Week. We often work with landlords who have got adapted properties to let them out. So it's always worth getting in touch. We'd be delighted to try and help match the right people up with those properties if we can.
Great. And it's just a question from Amanda, last one from Amanda. It's not just already accessible properties you adapt. Do you find properties that then need adaptations and arrange that as well? Yes.
So quite often we don't find properties that are already adapted. We have, you know, we look at the plans, we see that they are adaptable, and then project manage those. So yeah, I mean, you know, I'd say the biggest request we get for is 2-bedroom ground floor flat, you know, and you would think that is quite an easy search. Again, it's not, just because getting through the front door is the first issue. And, you know, and then obviously with the corridors being narrow inside. So, you know, we just have to take all of that into consideration when working with clients. And quite often it comes down to compromise somewhere along the way. Obviously that can't the physical requirements can't be compromised. So it often comes down to location or budget or something along those lines.
Great. Well, thank you, Sally. That's been really interesting, really useful, I think, and good to have kind of an insight on supporting people to move as well as to stay and adapt.
Well, thank you. I hope it was. I hope it was, and I'll put the details for the guide in the box shortly.
Great, thank you. There's lots of clapping hand emojis.
I can see them all going up. Thank you.
So, next question for you to answer in the chat. How much of your DFG budget is discretionary? So, some of it, none of it, all of it? I'll take a percentage, description. Does anybody want to offer a figure? Or are you all hesitating because it might be a trick question? Okay, so I know some of it is, but have no figure on the idea, no set amount. And to a certain extent, it is a trick question because it actually is all discretionary. You can decide how you spend it, particularly if you have an RRO policy in place. And some local authorities don't do any mandatory grants because they all do them through their RRO policy. So I think it's worth always remembering that the whole of your budget is discretionary. And all of those should be included in your Delta return to the government, which is out now. If you haven't already had an email through asking you for it, then please let us know so we can ask the officials at the ministry to send you the details through. There was 100% return last year, so every local authority in England made their return. And so it'd be great if we could do the same again this year. The questions are almost exactly the same. So hopefully it should be fairly straightforward to fill in. But please do check if your local authority hasn't had it, then please get in touch with us at Foundations and we will, ask the ministry to send you the details. So now I just wanted to tell you a little bit about Foundations Independent Living Trust, which you may or may not be aware of, but it is the charitable arm of Foundations. And it was set up in 2001, so a year later than Foundations. And the idea was to provide hardship funds for vital repairs and improvements to the homes of clients of home improvement agencies. So basically, it was set up to create a hardship fund. Issues around keeping people warm, safe, secure, as part of their communities and local support networks. And it also works with Care and Repair Scotland and Care and Repair Cymru to provide funding right across Great Britain. So mainly how it works is it secures funding, or we secure funding from various organisations and then distribute that through the network of home improvement agencies to pay for certain repairs and adaptations. So it's had, yes, so it's nearly 20 years old. We currently have funds from Gas Safe Charity, Northern Gas Networks, and we have regular donations from Taylor Wimpey. And as well as kind of the hardship fund, back in 2006, it changed from Foundations Trust to Foundations Independent Living Trust. It added some secondary priorities. So it's providing practical support for home improvement agencies in delivering their services to vulnerable people, such as training, disseminating good practice, improving IT capacity and collective purchasing, and also to support research programs that will improve understanding and promote solutions to the problems facing vulnerable people who need to adapt and repair their home. So I'm going to give you some examples of some of those. So a couple of years ago, we set up a dementia fund with some funds from Taylor Wimpey, working with 4 agencies across the country as a kind of a pilot program on some of the things that could be done to support people living with a diagnosis of dementia. And for example, this was a photo. I don't think it's the actual photo, but a photo of something that was a program. And in this particular case, they were all fitted by the Home Improvement Agency's Handy Person service. Back in, I think this was 2015, 2016, when floods hit Cumbria and Carlisle, the charity worked with NPower, or then Department of Communities and Local Government, to fund a flood caseworker or a flood worker who went round Carlisle supporting people to apply for grants and basically to do the necessary repairs to their homes. So over a period of time, he saw hundreds of people and had really positive outcomes. So there's a report on the Foundation's website all about the Carlisle flood worker, which includes some reflections on the scheme and some tips if you would like to follow that in future, or maybe copy it, and a job description of the flood worker themselves. So those are some of the things we've done in the past. So some of the things that are new or that we're working on now as part of the trust. So we've recently secured nearly £300,000 from the Energy Savings Trust to incorporate advice on fuel poverty and warm homes into visits for DFG applications. So we've got funding to train staff in 25 areas on fuel poverty and warm homes, plus other bits and pieces like safeguarding, loan visits, mental health awareness, dementia awareness, COVID safety. That's also all available free to those 25 local authorities. And then each time they visit a household and give out fuel poverty and energy efficiency advice as part of a DFG visit, they get a payment of £27.50. And they also have a pot of funding to pay for small measures, things like draft proofing or letterbox covers that could be fitted by your local handy person service. So most of the 25 places have already gone, but if you're interested, then please drop us an email at info@foundations.uk.com and we'll send you all the details if you'd be interested in getting involved with that. It's kind of part of the push to see that kind of making every DFG visit count, so that if while you're there, you can give a little bit of energy advice and make sure that somebody's living in a warmer, safer home, then why not? Why not? Other project is through Northern Gas Networks, additional to our long-standing partnership with the Gas Safe charity, is to create, I suppose, delivery of gas safety works right across the north of England. So on this map here, the areas in purple already have an allocation from Gas Safe charity to do gas safety works and gas safety checks in the homes of homeowners. The greeny coloured areas have access to our central pot to have funding on an ad hoc basis, and the white areas don't currently have funding. So thanks to NGN, all of those areas can now access more funding, and Roy McNally, who I know is in the meeting today, is looking to work with all those areas across the north of England to make sure that there's gas safety interventions available everywhere. And the great thing about working with the gas safety organisations is that they all work together. So hopefully, if this is successful, it will spread across the rest of the country and allow home improvement agencies to do far more gas safety work everywhere in England. A brand new project that we're doing, again, this one is with the support of Taylor Wimpey, is some research on the social value of adaptations. So what savings do adaptations generate across the public sector from the work we all do in providing them? That's underway now, and we hope to have a report due early in the new year. And in some ways, I suppose it was good news that the comprehensive spending review has been postponed again. So I think this will be a key piece of work to feed into the next spending review, as the methodology is recognised by the Treasury as one they use in their calculations. So this should be available in the new year, and I think it will be a really powerful piece of work. Another one, I think I've mentioned this one before, but working with Rachel Russell, who many of you know used to be at Salford University and worked on adaptations without delay a couple of years ago. It was published last year. She's now at Calderdale Council, and the plan is to develop a tool that you can use to help decide the complexity of a case, and then whether or not it should be assessed by an OT or by a trusted assessor. So trying to make that kind of have a decision tree to make that process a little bit easier, and working on that at the moment. And again, hopefully we'll have something on that in the new year. So you can see we do quite a range of things, and we get kind of funding from a range of places. So if you've got an idea, do you have a problem you would like to be resolved or investigated? Is there something you're already working on that we could help you with or work together with you on, and kind of share it more widely? If there is, you can email me at pauls@foundations.uk.com, or drop a message in the chat box, or send me a direct message, and we'll get in touch. So if there's anything you're interested in, please let us know, because we're always looking for ideas for what we can do next that would support you and support others across the country. So that's Foundations Independent Living Trust. And just a reminder, I'm sure most of you must already be a member by now, but we do have a DFG Champions Facebook group, which is a private group. I think it's got 1,150 members now. And it's got a new feature where you can sign up to a mentor if you're fairly new to the sector, and get some help and advice. Or if you're an old hand, you can also sign up as a mentor and support somebody newer. So www.facebook.com/group/DFG Champions, and you can sign up there. And I think the other great feature is that if you've got any DFG related questions, post them there, and you've got over 1,000 other people who will give you a hand.
The DFG surgery. Your questions answered.
Right. DFG surgery time. Let me just check the questions section. I think they were both questions so far were ones for Sally. So has anybody got any DFG questions that they want to either put in the chat or the questions box? If not, I have got some emergency questions. So while you're thinking about any questions, I mean, you can also raise your hand if you're feeling brave and you want to ask it in person. You can raise your hand and take the virtual microphone and join me on the main screen. So, but while you're thinking about it, first emergency question one was posed on the Facebook group, I think it was last week. So can an individual living in a park home for 10 months of the year be classed as ordinarily permanently resident and therefore considered for DFG? So there's a couple of points on this one. The ordinarily permanently resident bit, or ordinarily resident, is a social care term, so it doesn't quite apply in the same way for DFG. But somebody living in a park home can apply for a DFG as an occupier. So it would be an occupier's application, which I guess probably many of you don't have a form set up for an occupier's application, but it is something that can be done. And there's a section in the legislation that explains it. And the legislation talks about it being somebody's only or main or only residence. So as they're there for 10 months of the year, it's their main residence. So yes, they could apply for a DFG as an occupier based on them living in a park home for 10 months of the year. So question from Brian, is the remainder of DFG grant 2019 being folded into 2021. So the grant from government was all paid out to local authorities in 2019 and 2020, but it's not untypical for local authorities to then carry forward their spend or anything they haven't spent over into the following year. So that's relatively typical, and I think probably the majority of local authorities do carry forward some funds, either for jobs that have been approved or not completed, or for jobs that have been, or even just if they haven't spent the rest of the money. So emergency question 2. I'm wondering if anybody has an experience of funding a safe pod via the DFG if attached to the floor for a child with sensory processing and significant behavioural difficulties. I think the gist of this question was around it being attached to the floor, which is a common question that quite often comes up, or quite often a common myth, that something has to be fully fixed and attached for it to be funded through DFG, which isn't actually the case. Guidance way back in 1996 set out that there is an overlap between what social care legislation can do and what DFG can do. And it said there should be a local policy between districts and counties, or between housing departments and social services, on who funds what. And it suggests that generally things that are structural and fixed would be DFG, and things that aren't would be more social services. But that's not a firm rule. It's definitely not in the legislation. So the attaching to the floor of a safe pod or not doesn't really count in terms of whether it's DFG eligible or not. Question on the chat about getting outside in accessible gardens. So, David, one of the purposes of disabled facilities grants is access in and out of the dwelling, which obviously dwelling includes the garden. And there was an extra purpose added back in, I think it was 2006, 2007, that said that one of the purposes of DFG was to get out into the garden, or to get access to the garden, and to make the garden safer if that's appropriate. So yes, access to the garden and outside is a purpose of DFG. Always feel a bit like Martin Lewis when I'm doing this section. And question number 3, not question number 2. Can DFG fund a drop curve pavement crossing to give access to a hard standing for a car for a wheelchair user? Now, again, sometimes it's thought that as the drop curb is outside the curtilage of the property, then you can't do a hard standing for a car. Sorry, you can't do a pavement crossing to give access to a hard standing. But actually, there is a little known clause in the DFG regulations that say where the works are either for access purposes, or whether to join things like drainage or services into the property, then you can fund part of the adaptation that is slightly outside the curtilage. So actually, it is totally legitimate to fund a pavement crossing, drop curb pavement crossing through DFG. So let me just check on any other questions. Does anybody want to raise their hand? Or Brian's just asking about 2020 to 2021. So all the funding for 2020 has also been paid to local authorities. And if you need to carry that forward to 2021 because you haven't spent it all, then I don't think there'll be any issue with that. However, there are a number of local authorities that have already spent the money for this year and would be quite happy to get some more. So it's not every local authority that's struggled. Okay. Any last questions before we move on? So David talking about lack of OTs being a big problem. I think it kind of comes back to kind of thing we mentioned before about triage and trusted assessors. That a lot of local authorities are looking at how they can do that assessment bit differently. And we had a webinar last week where housing departments had OTs co-located with them in that department, and we heard some of the benefits of doing that. So that recording from last week is now on our YouTube channel. So if you want to look back on that, there's I think 4 or 5 OTs from around the country talking about the benefits of working within a housing department. And we'll also be covering some of that in another event in a few weeks' time. So just before we wrap up, and you can go back to the tables and the speed networking, just another reminder that we do have lots and lots of online training available on all of these subjects. So if you're a manager of a home improvement agency and you want to get access of these for your staff, or to be honest, anybody you work with, if you're a manager of a HIA, you can pretty much give it to whoever you want. We're not going to check, to be honest. So if you want to sign up and get access to all these courses, you're very welcome. They're all free. Each one takes about 30 to 60 minutes to complete, so they're relatively short. If you just want to do a one-off course, there's a booking form on the website. But I say, if you're a manager, you can then be signed up to the portal that manages all this, and you can assign courses to your staff yourself, which obviously makes it a lot easier. So if you're interested, drop us a line at info@foundations.uk.com.
Poll time. Let's see what you think.
So we're drawing towards the end of the webinar. This is kind of the first Airmeet we've done. So I will open up the poll again. So what do you think of Airmeet? Do you like it? Yes or no? I think almost unanimous. 96% of people like it. So that's good to me. I'm pleased you like it. I think it has quite a few features that I mean, we can kind of socialise again a bit like we used to in real life. So thank you for attending this slightly experimental webinar today. I think I've got the hang of all the buttons now. It's all in slightly different layout to Zoom, and I've got the presentation on a different screen. So if I keep looking to the side, that's why. But we've got another monthly webinar in November, and then a date for your diary is the 1st of December, where we're going to have a virtual Foundations Roadshow that also includes the National Healthy Housing Awards in the afternoon. So the afternoon session is the award ceremony itself. But for the roadshow, we've got 2 sessions kind of in the morning and around lunchtime. One of them is looking at some of the research that's come out on adaptations recently. So there's one looking at the DFG process. Another really interesting one that looks at a team where they've introduced trusted assessors and changed some of the professional roles and the impact that that's had on staff. And a third one is Philip Whitehead from Northumbria University, who's going to give an update on the Bath Air project, who've kind of completed phase 1 and are moving on to phase 2. And if you haven't heard of it before, it's looking at how the delays in completing shower adaptations impacts on the well-being of the recipients of those. And then in the second session, we're going to be looking at issues around, I suppose, kind of adapting again in the current circumstances. So we're going to hear from a county council that's introduced a new virtual assessment scheme and how the kind of issues they've had with introducing it and the kind of pros and cons and where it works and where it doesn't. We'll also hear from AbilityNet, which supports people to use the technology, so kind of service users or the public, and some of the issues they have and some of the things they'd like to see in terms of support for people if they're going to use some of this technology going forwards. We've got a session from a private OT firm who's looked at OT waiting lists and some of the issues associated with those and some of the solutions. And last but not least, we'll hear from one of the local authorities I mentioned who have already spent all their money for this year and are already thinking about how they up that for next year. So a packed day. Lots of information will be coming out on that over the next few weeks. But that's all day on the 1st of December if you want to put a note in your diary and not book any visits for that day. It should be a good set of sessions. As always, we're here to help. So if there's anything around training, events, workshops, support with DFG, support with home improvement agencies, anything like that, please get in touch. We've got 5 regional advisors around the country who are there to help you. So anything you like, please get in touch and we'll see what we can do. So that's the end of the webinar bit. Thank you for joining it, and I will close the session now. And hopefully you can return to the tables, enjoy the meetings and the tables, and perhaps do a bit of speed networking as well. So thank you for joining us today. Enjoy the tables, and we'll be back with another webinar again very soon. Thank you.